At one time, a positive HIV diagnosis left patients with little hope. Today, however, breakthrough medicines are helping many people manage their disease and look forward to years of good health. But why is it necessary to take so many different kinds of pills? And why is it so important that people infected with HIV take their pills on time and follow all the directions on the prescriptions their physicians write for them? We'll be exploring those questions and examining how people infected with the virus can help fight the war on HIV. To understand how we're fighting the war on HIV, we must first understand how HIV, the human immunodeficiency virus, attacks the body and forms resistance to drug treatment. You may already have a basic understanding of how HIV, traveling in the bloodstream, attaches itself to a CD4 cell, sometimes called a T helper cell. This is a white blood cell that is part of your immune system, the system that is designed to help your body fight infection. But when HIV invades, it turns CD4 cells into HIV factories that will produce billions of more HIV viruses every day. Well, how does the virus do that? How does it turn the very beneficial CD4 cell into the enemy? To understand that, we have to go inside the cell itself, right to the battleground of the war on HIV. This is where the virus employs its first battle strategy. Once the virus is attached to the CD4 cell, two single strands of HIV RNA enter the CD4 cell. The HIV RNA carries the instructions for producing more of the virus, but is unable to reproduce until it transforms into HIV DNA. Only one of the two RNA strands will actually infect the CD4 cell. The other is simply a backup in case something happens to the first strand. In order to reproduce, the single-stranded RNA must convert to double-stranded DNA. It does this with the enzyme known as reverse transcriptase. The HIV DNA then moves into the nucleus, the very heart of the CD4 cell, where it becomes part of the CD4 cell's own DNA. Once HIV DNA is in the nucleus, it hijacks the CD4 cell and instructs the cell to produce HIV virus in the form of a protein. Up to 10 billion copies of the virus are produced in the body each day. With that many chances, the CD4 cell sometimes makes mistakes in producing the protein. These mistakes, or mutations, can be beneficial to the virus and harmful to the person who is infected, because, as we'll discuss later, the mutations may actually help the virus resist treatment. After the protein is produced, another enzyme called protease cuts the protein into usable strands that form new virus with its own RNA. The copies of the virus are then sent out to attack other CD4 cells. CD4 cells are found in two stages, activated and resting. Activated CD4 cells have been turned on and are dividing for the purpose of actively fighting infection. Resting CD4 cells have not encountered any infection and are waiting to be triggered into action. While activated and resting CD4 cells are both attacked by HIV, when activated cells are attacked, instead of replicating, they reproduce the virus much faster and in greater amounts. To suppress the virus to undetectable levels, drugs must fight it in both activated and resting cells. It's important that you know how HIV works, so you can understand how different types of drugs called antiretrovirals stop the virus from completing its reproductive cycle. The first antiretroviral drugs to be developed are known as nucleoside analogs. The virus begins to produce its DNA, but the nucleoside analog doesn't allow it to complete the process, and the incomplete DNA is unable to make the CD4 cell produce new copies of the virus. Some nucleoside analog drugs, such as Zerit and Retrovir, are known as thymidine nucleoside analogs. These drugs seem to work more effectively in activated CD4 cells, those cells that are actively dividing and fighting infection. Non-thymidine nucleoside analogs such as Videx, Hivit, and Epivir are more effective in resting CD4 cells, those cells that are waiting to be called into action. Many physicians will prescribe both a thymidine and a non-thymidine nucleoside analog so that the war on HIV is fought in as great a number of CD4 cells as possible to prevent HIV from making copies of itself. A newer class of drugs are the non-nucleoside reverse transcriptase inhibitors, sometimes referred to as NNRTIs. These drugs, such as Rescriptor and Viramune, inhibit or stop HIV production by attaching to the reverse transcriptase enzyme itself and preventing the enzyme from converting the HIV RNA into DNA. Protease inhibitors such as Inverase, Crixivan, Norvir, and Viracept work at the final stage of the virus reproduction cycle. These drugs prevent the protease enzyme from cutting the HIV proteins into usable lengths. That means the protein cannot be successfully assembled and released from the CD4 cell to do further damage. No drug is 100% effective in stopping the virus from reproducing. That's why physicians often prescribe several antiretroviral drugs. Recent treatment guidelines recommend a combination of drugs that usually includes a thymidine nucleoside analog and a non-thymidine nucleoside analog as the core of treatment. Sometimes they will also add a third agent. Most often it's a protease inhibitor, but it also could be an NNRTI. To recap, the thymidine nucleoside analogs such as Zerit and Retrovir work most effectively in activated CD4 cells. The non-thymidine nucleoside analogs such as Videx, Hivit, and Epivir work most effectively in resting CD4 cells. NNRTIs such as Rescriptor and Viramune bind to the reverse transcriptase enzyme and prevent it from converting HIV RNA into DNA. And protease inhibitors such as Inverase, Crixivan, Norvir, and Viracept prevent the protease enzyme from assembling and releasing HIV copies from the infected CD4 cell. The decision concerning when to begin therapy and what therapy to use for an HIV-infected person is best made by the physician and a fully informed patient and is based on many factors. Among the factors physicians take into account before starting therapy are the viral load, or the amount of HIV in the body, the CD4 cell count, and AIDS symptoms. As the virus grows in the body, CD4 cells are destroyed and decrease in number. When effective medication is introduced, the viral load begins decreasing, while the number of CD4 cells increases. People who are able to reduce their viral load below the level of detection have had the best results with treatment. Some physicians may prescribe medication at any viral load or CD4 cell count. However, since the goal of HIV treatment is to lower the viral load as much as possible, the higher the viral load and the lower the CD4 cell count, the more likely it is that the physician will prescribe therapy. Most physicians recommend that patients with HIV symptoms, such as thrush and other mouth sores, chronic unexplained fever, night sweats, and weight loss, should be placed on antiretroviral therapy. Once a person infected with HIV is placed on drug therapy, it's very important that the medication be taken as prescribed, every dose, every day, because when treatments are missed, the virus has a chance to regain its foothold. Remember, the HIV virus often mutates into strains of the virus that are resistant to the drugs being used to fight it. By keeping the viral load as low as possible, there is less opportunity for these mutations to be produced and spread. Each drug is prescribed at a dose that has been shown to be most effective, so it's important each is taken precisely as it's prescribed. By adhering to therapy, The HIV-infected patient gives a virus less opportunity to mutate into a virus resistant to therapy. That's because even if a few mutant viruses do survive, while they may be resistant to one drug, it's unlikely that they'll be resistant to all the drugs that the doctor prescribes. Taking all of these drugs can be difficult, but I urge you to take all of them as prescribed. It's the only way we know to keep the virus in check. By sticking with the prescribed treatments, the person with HIV gives him or herself the opportunity to live a longer and healthier life, and to have a better chance of victory while fighting the war on HIV.